Everyone, welcome back to the surgical canvas. Today we are going to discuss the fingertip injuries. Fingertip injuries are among the most common injuries of the hand and they can be deceptively difficult to reconstruct. The goal is not simply to close the wound, but we have to preserve the length, sensation, pulp, nail support, function, durable soft tissue support. Today we will discuss the major advancement flaps. Coming to the first, Atasoy V-Y advancement flap. This flap is useful in case of fingertip injuries in oblique direction where the volar part is preserved while more injury has happened to the dorsal part. Volar bulk of the tip is still present. A V flap is designed which contains the volar skin and is raised and converted to a Y flap. The final incision appear like a Y shaped. Similarly, we can also go for Kutler's lateral V-Y advancement flaps. Here, instead of the volar skin, the lateral skin V flaps are raised bilaterally and are brought together in the midline. The final incision appears like this. Segmüller is a modification of the Kutler's flap. Here, instead of just raising V as in Kutler, we completely islandize this flap and do the neurovascular dissection and then advance the tissue. The advantage of complete islandization of the flap is that it leads to greater mobility and the flap easily reaches the center. Now comes the Venkataswami oblique triangular flap. Here we need even more mobilization compared to Segmüller's advancement. Here we do further neurovascular dissection and raise the flap to the proximal phalanx, and even our stitch line can go up to the palm area. We do the dissection and raise the neurovascular bundle and cover the defect. Here the most distal part of the flap can be asensate, as the most distal part of the flap will be receiving the neurovascular supply from the contralateral side, and while raising the flap, this contralateral side may have been cut. So the distal parts may be asensate. So it is one of the disadvantage in Venkataswami flap. But the advantage is that we can achieve greater mobilization and moreover we can use a large amount of the volar skin here. Now coming to the Moberg advancement flap. This flap is specifically designed for thumb tip injuries, as sensate skin is very important for sensory functions such as 2-point discrimination. Here we completely mobilize this volar skin and advance in block to fill the defect. The disadvantage of this procedure is that there is a permanent flexion deformity at the interphalangeal joint. Now coming to the furlough cup flap. This flap is more useful in case of an oblique fingertip injuries where the volar part is more damaged compared to the dorsal part. Here we cannot use Atasoy flap with ease because volar part is already damaged in large amount. Here we make a broad V-shaped flap and do complete islandization, but we have to make sure that bilateral neurovascular supply is intact, and then when we have raised this flap, both ends of the base are to be brought together in the midline and closed. So finally we do the advancement and fill the defect. The advantage of this flap is that we get a good pulp, and as the both neurovascular supply from both sides are intact, the whole of the flap is a sensate flap. Now coming to the Gigone flap. In Gigone flap, we design 2 or more simultaneously V flap and do advancement, and we get 2 or more V-Y advancement, as you can see here. Now let's solve some questions. A patient presents with transverse amputation of the distal thumb and exposed distal phalanx, but the adequate volar pulp remains. Which advancement flap would you choose? We will use Moberg flap. because Moberg flap provides complete sensate skin, and sensate skin is very important in case of thumb. Which advancement flap uses two lateral flaps rather than a single volar flap? Single volar flap is Atasoy flap and two lateral flaps is Kutler's flap. Now third question. You have a fingertip amputation with exposed bone. The patient wants maximum preservation of finger length. Is the longest possible advancement flap always the best option? Why or why not? No. The longest possible advancement flap is not always the best option. Excessive advancement can create tension, compromise vascularity, cause flap necrosis and produce a painful or functionally poor fingertip. Thank you.